Dr. Gerber comes from Reno, Nevada. I had the pleasure of meeting him in 1994 at the IABDM meeting. At that time, it was the American Academy, instead of the International Academy, and he was a speaker for the group. Michael received his doctorate of medicine from Kansas University School of Medicine in 1972. He has a homeopathic and integrative medical practice in Reno, which he established something like 37 years ago. He's been in practice, and Michael's involved as an active member in the Nevada Homeopathic Physicians Association. Are you still president of the... Yeah. Michael has been, I think, if you see this gentleman, you've seen all the presidents for the group called the Nevada Homeopathic Integrative Medical Association. He is a member of the IABDM and the ICIM. It's my great pleasure to introduce Michael Gerber.
Thank you, Michael. What a great guy, and has done some life-saving work on my family and me. So we'll move right along. First of all, I'd like to thank the groups for having me. I'm very honored. It's a good-looking group, folks. And secondly, I'd just like to pause for a moment to thank all of our teachers and all of the people that have made us interested in this kind of medicine and dentistry. And a lot of them have passed on, and it's a good time to always remember our teachers and people that have started us out, and many are gone, and it's our job to hold up the light. And as Hippocrates said, life is short and the art is long, and he meant medicine. So I know we have a lot of dentists here and a lot of detox guys, but as Dr. Yu was in Reno at the IABDM IAOMT conference in September, and I enjoyed his quip that we, more medical side of things, send all of our, after an office visit, we send our patients to the dentist, and, $13,000 later they come back to us. But there are things that we can do to help out. And I did, we talked about detoxification, and certainly one of the major systems that runs us is our autonomic nervous system. And the autonomic nervous system gets disrupted and toxic, and how can we clean this autonomic nervous system? So we'll talk a little bit about neural therapy. How many of you guys do neural therapy out there? Thank you. So I think everybody should know it's wonderful stuff. And you guys know how to identify cerebral foci. We're going to show you about cervical lymphatic drainage, review some ozone therapy, and some sphenopalatine and sinus ganglia injections, IV vitamin infusions. I'm sure you guys mostly know these. We'll do a little bit more on mercury detox, hair analysis, chelating agents, far infrared sauna, talk about removing environmental toxins. You can move heavy metal out with chelation, but the plastics, the pesticides, the herbicides, the volatile organic hydrocarbons, the PCBs, the dioxins, all the other stuff that we carry around, pretty much only come out with sweating. Also, we like to look a little bit more at Lyme, and H. pylori is a very sought bug. 50% of us have. Mold, parasites, viruses, and toxoplasmosis is something to find in your patients that have difficult neurological symptoms, and so it's worth looking at. And finally, just a brief word about sepsis. So here's Dr. Simon Hughes Quip in Reno. So we need to do our part to follow up with our dental brethren to ensure a smooth detox. And I'm always amazed that regular docs never look in the patient's mouth, for God's sake. And you look in the patient's mouth, oh, you have 17 mercury amalgam fillings. And the patient says, so what? And that's coming off, that mercury's coming off into your saliva and your breath every time you eat hot food, hot liquids. And it causes, as we know, loads of neurological and other damage. And root canal teeth, as our dental brethren always say, is the corpse in the attic. What do you mean by that, Doc? I said, tooth's dead. And it's just dumping all these bacterial toxins into your body, as you guys know. And so here are these focal tooth interference fields. This is not my favorite slide of this, or graph of this, but you guys are very aware of the distant ramifications that teeth have. And, they're all sitting on one end of those acupuncture meridians, and they go right down to distant parts of our body. And again, this patients have no clue that teeth can have effect on distant part of their bodies. And like our previous speaker, people walk in and say, well, I've been to 27 doctors and nobody is telling me anything about why I'm chronically ill. And do you have root canals? Oh, yeah, I got 5 or 6. So identifying root canal teeth and looking at these powerful endotoxins coming out of the multitude of bacteria and fungi living in teeth: scatols, pyrroles, indoles, thioethers, mercaptans. And these all inhibit phosphorylases. And if you don't have good phosphorylases, you can't make ATP. And if you don't have ATP, your poor mitochondria are suffering. And not only is energy going to be bad, nothing works. And as we know, it also is a precursor to cancer. Because cancer is a mitochondrial disease. It's not a nuclear disease. It's the mitochondria going down and not making the ATP, and then the DNA mutations start happening. Also, I'd like to acknowledge Dr. Levy. I think I heard him. You like this one better, all right? Dr. Levy, we were fortunate enough to be on a stage with him in Vancouver last May, and he brought forth his 2014 book in a review. It's called The Toxic Tooth. And if you've not seen that book, it's an updated version of the Weston Price's book of 1923, The Price of Root Canals, and George Meinig's The Root Canal Cover-Up in the 90s. But this has new age stuff, PCR quant identification of nuclei of bacteria that are in clots in the heart and the brain, and pulmonary emboli and DVTs. So people come, I'm perfectly healthy. Why in the world do I have deep vein thrombosis? And it's coming off into my pulmonary, into the lungs. And frequently, it's the coagulopathy that come from these bacteria. And he does a beautiful job. But especially, I love the color plates of root canal teeth. How many of you guys have seen Levy's book? Great. Yeah, it's wonderful. So, as you know, as I know, taking out, damaged, diseased teeth is a little bit of a hard sell. There's nothing nice about it. Expensive and pain in the bottom to do. But you start showing these god-awful green and black teeth that are root canal teeth that come out on these plates in Levy's book, and the patient goes, oh my God, is that what's in me? And so it really helps to move patients into getting the repair work that they need on their root canal teeth. And yeah, I love it that there are, 8 teeth related to the breasts, and so we'll talk about a little neural therapy here for a minute. Neural therapy uses procaine, And you can inject this intradermally as wheels in the skin and into joints and nerve ganglia. In 1905, Einhorn discovered procaine. It had been developed by scores of German researchers, especially the Hünecke brothers, Walter and Ferdinand, during the 1920s through the 50s. And procaine reverses damaged membrane potentials of the nerves and seals the cell membranes, allowing potassium to flow in and sodium to leave the nerves. Toxins and waste products are carried off to the cell environment. Cell is stabilized and its function again becomes normal. It's phenomenal for resolution of pain and neural dysfunction. So it's absolutely indispensable. And here are the Hünecke boys. There's I think Ferdinand on the right there, and as you see, he's got that little divot in his right forehead where he was shot in 1918 in World War I and had intractable migraine headaches. And these were improved greatly by the use of procaine. I think they called it Plemlitol at the time, but got rid of his headaches. So Peter Dosch put out a book from Hauch in Heidelberg in 1985. It's called the Regulating Therapy with Local Anesthetics, and this is all about the Hünecke's work. Courses in neural therapy are taught by Dietrich Klinghardt, our mentor, bless his soul, MD, PhD, and he has a 10-DVD teaching set of neural therapy and mesotherapy in 2005, which is available from the American Academy of Neural Therapy. So I recommend that everybody learn how to do this because it's so valuable. And I don't know, and you guys ever read my monthly miracles column in Townsend Letter? You know, about two of you. So if you get Townsend Letter, it's a marvelous source of information put out by Jonathan Collin, who's the publisher. And that's what I call my title of my humble title, Monthly Miracles. But you can get a lot of miracles in your everyday practice by doing neural therapy and learning some techniques. So we just use 1% procaine buffered to a pH of 7 with potassium hydroxide and no epinephrine, and your compounding pharmacy can make this for you. So identifying dental foci, again, I always encourage the doctor, look at the mouth. There's lots you can learn from Chinese tongue diagnosis. Tongue tells you a lot, lips tell you a lot, face tells you a lot. But you can identify by the foci by EAV, autonomic response testing, a la Klinghardt, Cavitat, which trying to be disappeared, cone beam X-ray, 3D CAT scans of the maxilla and mandible, thermography, and the Hünecke lightning reaction. The lightning reaction occurs when you inject procaine into the buccal membrane next to a compromised tooth or a scar or any foci with procaine, and you can do a little lidocaine spray to reduce the pain. And if a distant pain or symptom is relieved for 12 to 18 hours, that means that that tooth is probably responsible. So you can get see a funky looking tooth or a root canal tooth, or even the holes where the wisdom teeth were, because as you all know, that if the wisdoms weren't taken out according to the best German biological dental techniques and the periodontal ligament is left in, and this is a little controversial, but we can test all these teeth with electroacupuncture, and frequently there's a cavitation right there. If the ligament didn't come out, the bone still thinks the tooth is in there and may not heal the cavity where the bone was or the tooth was, and you can get a chronic infection. So this is another one of those hidden foci that people, they walk in, healthy lifestyle, they exercise, good food, good genetics, they look great, and yet they're chronically ill. And especially the wisdoms are the heart teeth, but they also control autonomic dysfunction, dizziness, ear pain, sinus stuff, all that comes from the teeth, as you know. So integrating understanding of dental foci is extremely important. And if you see a big hole in the center of the tooth, it's usually a root canal tooth. So always ask the patient to call up the secretary of their dentist and ask, what are the numbers of the root canal teeth that I have? Well, I love this slide. This is thermography. How many of you guys have access to thermography? Good. Wonderful. So, yeah, don't do mammography. It's a lot of radiation. And if somebody has, mammography 10 times, it's 100% likely that they'll have a false positive and do a biopsy, which then creates more scar tissues, and then more procedures in needless biopsies and lumpectomies and radiation and chemo, etc. So the cervical lymph drainage is something that the Germans have been into for a long time in neural therapy. So after surgeries for root canals, extractions, cavitations, amalgam removal, and any dental infection, using lymphatic drainage with procaine and lymphomyosat from HEAL, which, by the way, is still available from Emerson Ecologics and McKesson, is an amazing technique. It reduces facial, dental pain, and swelling in the convalescence time after these dental procedures. When there are these golf ball sized swellings after surgeries, lymphatic drains almost immediately speeds pain relief. So here is a bit of a graph about lymphatic drainage. So these are intradermal wheels. I usually use a 30 gauge needle. Some people whose hands are getting too roughed up by pushing procaine through a teeny needle for 30 years would use a 27. But so these also there are ashi points, as one would say, where there are tender lymph nodes after these procedures. And this is a little bit of a grosser looking slide, but this is what it looks like. And you get these big red welts and histamine production, and it also wakes up autonomic nerve drainage out of the neck and the head. And it's absolutely amazing. People say, oh, God, it's been a week and a half since I've had my cavitation surgery, and I still have a lot of pain and swelling, and it's just really awful. And so this is the time when the dentist would like to send the patient back to the doctor so that we can aid recuperation and make this go a lot faster for the patient. Sphenopalatine is a little touchier. Sphenopalatine can be done from outside over the top of the cheekbone. It's about 1.5 inches towards the opposite wisdom tooth. Or as dentists can go straight into we can do straight into the zygoma as well. And you can use other homeopathic and isopathics from Picana, and used to have some other brands available. But they'll clear chronic infections and facial pain. So the procaine can be injected into the medial edge of the second molar into the greater sphenopalatine foramen, about 1 inch, and about a cc of procaine, and you can add other homeopathics into that. So the sphenopalatine is right here above the cheek, and it drains out all the goop from these toxic infected teeth. And sometimes it's absolutely magical how it'll transform pain and speed recovery. People that have, sometimes taking out bad teeth, we get into the sinuses, and you can get sinus infections and perialveolar infection. So you can go straight onto the zygoma, and right down on the periosteum with your procaine or notatum, or when you could get other fun German things, right into the straight on the periosteum of the zygoma, and it can be very helpful. And then follow that with lymph drainage, neck drainage. And so sometimes you'll do these shots on people, and they can get really fuzzed out. Oh God, I'm so toxic. My brain, I feel awful. This is terrible. I never want to do that again. You can't do that to me. But if you do the drainage, immediately they feel better. And so it's send them back to us. So So we also use ozone injected into the buccal membrane next to the teeth, and you can clean out cavitation surgeries with ozone. You can also give this above the maxillary canines to drift up into the sinuses. After Procaine, after numbing it out, you can drift several cc's of ozone straight up into the sinuses. And also, some people advocate ozonated coconut oil or olive oil applied to a cotton roll to the buccal membrane for 20 minutes or more per day in a root canal or a toxic failing tooth as a stopgap measure for infection. I will say that we've been having a lot more fun with IPRF lately, injected platelet-rich fibrin. So you take some blood out of the patient's arm or wherever you can get it and spin it in a high-speed centrifuge, 1400 RPM, and the white cells in the clear part of the serum comes to the top of the tube, and you can pull that off and again inject right into the dental site. And we use it in knees and shoulders and lumbar spines and hips and elbows. And one of the other, I think, lesser appreciated problems that come along with dental infections. There's a lot of data on periodontal infection increasing blood pressure. So I think hypertension can be, unexplained hypertension. Now I know that, essential hypertension, whatever that is. Don't know what that means. But a lot of times, if you treat patients' root canal teeth or even do the lightning reaction next to bad teeth, and you notice a decline in the blood pressure, that it can be affected there. Also, injecting IPRF right into the buccal membranes next to damaged teeth, or if there's curetted bone which has been cleaned out in the maxilla mandible, I think it really does bring down blood pressure. We had a patient who was on, 25 carvedilol twice a day and 2 tenors of lisinopril and 2 hydrochlorothiazides, keep the blood pressure from hitting up in the 180s, 200s. And after injecting into these areas where bone had been cleared out, she stands up the next day and says, "Oh my God, I'm so weak, I'm faint." And I think her blood pressure was like 90 over 50. So then stop everything and turn all the blood pressure meds way down. And then that lasted a good week or 10 days. So I think it may need to be a serial injection. But I thought it was very exciting to drop some people's meds way out. And, none of those meds are great for people to do forever. Now, this is an old recipe that I got from Ed McDonough, 1975. Now, I may have changed it some, but for docs that don't do IVC infusions, they're really wonderful. And especially for these bad bugs that are going around, we do 25 grams, 37.5, 50 gram C's for these real horrible flus that have been going around. We're seeing a lot of strep pneumonia. And so some bad bugs going around this winter. And the problem with sending these people to the hospital is you can't get any nutrition in them. You can't get any vitamin C in them. I won't do it. And as we'll see toward the end here, it's very valuable in sepsis. So you guys can read the cookbook here. But I think Ed McDonough is still on the planet. And he's from North Kansas City, Missouri. And a great guy, has done a lot of early work in chelation therapy, showed the clean outs of all of the carotid arteries, improved the blood flow by 600% in the carotid arteries after 30 chelations. And he and Randolph, his buddy, have put out a lot of great stuff, especially back in the 1980s. So there's a lot of great work that's been done. So you can read this, and vitamin C, calcium gluconate, magnesium, sulfate, potassium chloride, B6, B5, trace elements. Hydrocortisone is always helpful. And this is bioidentical, Hydrocortisone is bioidentical. And after the work of M.C.K. Jeffries, have you guys read M.C.K. Jeffries and the safe uses of cortisone? Yeah, a couple of folks. In 1948, Jeffries he studied endocrinology at Harvard, And in 1948, they finally got enough hydrocortisone to treat patients, and so they would give rheumatoid arthritis patients 100 to 200 milligrams a day, and I'm not sure if it's IM or oral, and they'd pop them out of the wheelchair in 2-3 days. It was hailed as the greatest medical miracle of the century, and the two lead authors got Nobel Prizes in 1950. And then everybody started getting Cushingoid with moon paces and buffalo humps and thinning of the skin and deteriorated immune systems, and the backlash came. So, oh my God, this stuff is poison, don't use this. Well, it has actually a lot of great uses, and I think the lesson to be learned from them is that too much cortisone is immunosuppressive, too little cortisone is immunosuppressive. So we're trying to find the sweet spot. And so William M.C.K. Jeffries, for allergy patients and autoimmune patients, would do 5 milligrams 4 times a day. Unless they had a cold or a flu, then he'd give 10 milligrams 4 times a day, and without side effects. And it's also very useful, as we had learned last year, probably in treating cancer. If you do total estrogens in your cancer patients, these are adrenal estrogens. And, especially in guys, guys don't have ovaries, usually. And so here are all these very high total estrogens. They're adrenal estrogens, and they just drive prostate cancer and breast cancer like crazy. And Richard Pooley gave the talk last year in San Diego, Best Answer for Cancer. He's a reincarnated cardiothoracic surgeon. Working for representing Barnes Foundation, and also thyroid really reduces cancer like crazy. But he said, well, it's because the body's not making enough cortisol, and pituitary ACTH is going nuts, driving the adrenal, and the adrenal says, come on, I want more cortisol, and the adrenal says, I can't do it. So here comes more ACTH, and up goes the total estrogens, and that suppresses IgG, IgA, IgM, and so it suppresses the immune system if you don't have enough cortisol. So a little long-winded, but it's good to give that. And when people are tired and sick and their adrenals are smashed, and they like a little cortisol. And we've been doing our adrenal complex shot for 42 years with a little cortisol, a little DHEA, a little pregnenolone, and a base of sesame oil with methyl B12 and folic. The old feel-good shot's been around from Hollywood since the 1950s. And again, it really reduces convalescence time after viral illness or any illness. So a lot of people have very smashed adrenal glands. Clean Heart has a good mercury detox, neurotoxin detox article. And here's the citation for it. He gave this talk in Geneva, Switzerland in 2002. And again, he really likes chlorella and cilantro for mercury removal and gives specific instructions for their use. And again, take chlorella before, during, and after mercury detox. And so give everybody their chlorella when you're taking their amalgams out, so you don't change addresses of the mercury in the patient. Now, we've been hearing about methyls this morning, great stuff, and I just kind of use the hair as a screening, and I know it's better to use a challenge, but it's, getting people to, do the IVs and the pushes and stuff is a little hard, or you can do oral DMSA, of course, but I have great confidence. We've used doctors' data for over 40 years, and mercury, lead, cadmium, aluminum, arsenic, antimony, uranium, platinum are all big bad boys, as we have been told again today. And also, I like looking at the good guy trace minerals: sodium, potassium, calcium, magnesium, zinc, manganese, chromium, selenium, vanadium, boron, copper, rubidium, zinc. If they're all low, that means the stomach acid is probably low. And again, that can be secondary to hypothyroidism. And the hair gives a 6-month history of toxic metals, as we've heard today. Lead in blood, only 7 to 10 days, or maybe a month. So I don't know, did you guys jump up and down and scream at the TV last year when Flint, Michigan, had the horrible lead toxicity? finally, I heard about a month ago some people from Mayo, Rochester, Minnesota, say something about EDTA chelation. But that all those people, let's just build more mental hospitals. Yeah, let's just let all those kids brain rot, with lead, and not chelate them. So there is a lot of problem with lead and water contamination around the United States, for sure. And we know that EDTA since the 50s, 40s is the acknowledged premier chelating agent for lead. And you can give it orally and topically. Kelodyne topical cream, I think, works pretty well for little kids. And I see huge cadmium levels and arsenic levels in little kids. And out west where we live near Reno, there's some little towns that people come in, their arsenic levels are 20 or 30 times above the normal limits. And it just shuts down your mitochondria. Oxidative phosphorylate just shut down, and these people are horribly depressed and horribly fatigued. And getting arsenic out is not as easy, but I think sulfur compounds. So I've been doing the chelation thing since 1976. High aluminum, we use malic acid for high aluminum levels, which is in apple cider vinegar, red wine, and cilantro. And again, that's a little bit of a slow boat, but it does work. And for arsenic, we do use sulfur compounds to bind up the arsenic. And again, MSM, methylsulfonyl-methane, and cysteine. And uranium, again, is difficult. I think chlorella may go after some uranium, but we like to use the LA bath. That's Los Alamos bath. And that's half cup sea salt, half cup baking soda once a week for 3 weeks bath. And you alternate with apple cider vinegar once a week for 3 weeks. And it has to be, of course, real apple cider vinegar, not flavored. And you all know about EDTA and DMSA and DMPS and alpha-lipoic and humic and fulvic acids. I was just reading a piece, and Dr. Boyd Haley's his new chelator. I hope he's close to having it more available. I know he's got some great studies going in South America and Europe. And we used that back when he had it available, 6-8 years ago. Worked wonderfully well for getting mercury levels down, so we look forward to having available. There have been traditions, probably since the dawn of time, on bathing people in mud. And that's humic and fulvic acid, peat. And those guys are natural chelating agents. They have like zeolite and clays in them. And they are binders of heavy metals and all sorts of other toxins. So get your mud bath. And go to Calistoga, California. They have muds. And people have been going there for, decades for their arthritis. And it makes everybody feel better. And sulfur bathing, sulfur hot bath. Now, we were mentioning the far infrared. We could look up Detoxify or Die by Sherry Rogers, MD. And she spends the first 2/3 of her book telling us all that we are all toxic to at least 100 different substances. And I mentioned all the plastics and the pesticides and the herbicides. Did you read the piece where 78% of rainwater has glyphosate in it? Roundup. Oh my God. It's everywhere. It's everywhere, but it's not in Europe. So she'll convince you that we have all this. And the far infrared saunas, again, these guys come out by sweating. So it's a high-tech, low-temperature sauna and heats the body from the inside out. And they work at temperatures from 90 to 140 degrees instead of 140 to 220 in regular saunas. And you have to question people before you put them in there. How do you tolerate heat? Oh, God, it makes me terribly sick. I just can't do it. I'm sick. So you have to start really low temperatures and work up gradually. And you can also ask the patient, do you ever sweat? No, I just don't sweat. And so they're not going to get these toxins out of them. So a lot of it only comes out that way. And so if the patient is in for too long or too high a temperature, if they feel bad for 24 hours after the sauna. They've been in there too hot or too long, so start them lower. And we have little sauna spa places in our town, and the lady cooks them at 150 for, an hour and a half, and 30 minutes is really what the length of time most people should spend in far infrared sauna. And she would cook them and just dump all these toxins into their systems, and dump overweight people into angina and all that. And I'd spend 2-3 weeks cleaning up the mess. And so we decided we'd better have our own. So we have 2 3-man men's and 2 3-man women's sauna in our clinic with showers and organic hair products and stuff. So we think it's important to work on this end of detoxification, because we all have hundreds of chemicals in us, and that's the way to get them out. Well, we can be very beaten up by infectious diseases and infectious disease toxins, and so most of our chronically ill patients have infections. Lyme, H. pylori, moles, fungi, parasites, viruses, toxoplasmosis, and of course chronic bacterial jaw osteitis, infections in the jawbones, and small intestinal bacterial overgrowth. Chronic sinus infections are all pervasive. Lyme, I like EAV diagnosis. We're blessed in, I think naturopaths can probably use EAV machines. Most docs get killed if they use EAV, unless they're under the homeopathic boards in Nevada or Arizona or maybe other places. But you can measure all of these. You can measure Lyme in like 30 seconds, a minute. I was very pleased to read Klinghart's PCR urine evaluation, and IGeneX out in Palo Alto does this after a deep connective tissue massage a la Klinghart. Klinghart feels that Lyme doesn't really exist in our blood. It's mainly in connective tissue. So he has the patient do a deep connective tissue massage and then collect urine for the PCR, the polymerase chain reaction identification of the DNA, which is much more accurate than look at the IgG, IgM of Lyme. And some people say Lyme eats the antibodies, and if there's no antibodies positive, they won't reflex you over the Western blot. So it's another way of doing this PCR. So I'm still a fan of doxycycline, azithromycin, Cemento, it's cat's claw from Nutrimedics, with Kumanda, also another antibiotic tincture. And Gerber is a grass from the Andes, and it's a drainage remedy, and it drains lymph, liver, and kidneys. So when people get the Herxheimer reaction, you all know about Herxheimer's? No? Oh my God. The brothers Herxheimers were doctors that worked in Vienna and Munich in the 1840s. And they treated syphilis, which is also a spirochete, just like Lyme, and they treated with intravenous arsenic. Worked great. But all the little billions of syphilis cells would all, particles or bacteria, would all die at once, and the patients would have a Herxheimer reaction, which was 3 or 4 days of 106, 107 degree temperatures with racking pains and chills and hallucinations, usually treated with opiates. So killing down Lyme is usually not that bad, but at the same time, the Gerber helps the drainage. So people start to feel the aches and the pains and the brain fog and the depression, and so then the Gerber helps them pull out of it. It can be done several times a day. Argentin 23 silver has also been great in some people's hands, and we talked to the president of the Argentin company back in September in Reno. Great big guy, 6'6", big guy. And I said, well, how much silver do you use to treat, Borrelia, Lyme? And I said, 4 or 5 tablespoons per day. but you sure have to start slow. Same thing with the Cemento and the Kumanda. You've got to go into it very gradually with a drop of each, couple times a day. Let's stand a minute, and you gradually work up to 15 drops 2-3 times a day. And we always like to do 12 days on, 2 days off, because Lyme's pleomorphic, and so it goes from the corkscrew form into the cell membrane free form. So we try to catch it. So, and I asked him at the time, what were we doing Gerber for drainage and to fight the die-off or the Herxheimer reaction? I said, well, what do you like for the Herx? He says, oh, glutathione. So we liked the glutathione in high doses for that. And, you know, I was shocked to learn last year, and you guys have heard of coffee enemas, I betcha, kind of, sort of. Very famous for cancer stuff. But coffee enemas, there are coffee enema clubs, you know. Oh, yeah. People done them every day, every morning, 25 years. Doctor, you're not going to make me stop doing my coffee enemas. I love my coffee enemas. So 25 years. And besides turning on a bunch of liver enzymes for detox and drainage, it increases glutathione like 400 to 600%. No wonder people feel better. H. pylori. So 50% of us have it. It's transmitted oral, fecal, oral, shared cooking utensils. But I was shocked to discover a few years back that it does not only cause peptic ulcer disease, but a host of autoimmune diseases, neurological diseases, skin diseases, psoriasis, eczema, rosacea, Sjogren's, IPT, systemic sclerosis, lichen planus, chronic urticaria, and many more. So it causes, and all these skin diseases and neurological diseases, and some people's immune system can fight it. But, and of course, if somebody walks in with, you know, gastritis and, you know, peptic ulcer symptoms and, you know, GERD and stuff, it's always a good idea to look at it. And again, you can diagnose this several ways, you know, breath, stool, biopsy. But I like the Pyloracil out of Orthomolecular products and zinc, carnosine, mastic gum, berberine, Copticerb from China, and a little teeny bit of bismuth. And when it no longer tests well, and sometimes it takes several months to undo Helicobacter symptoms, but we like to use deglycerated licorice and mastic gum and cinnamon, little wafer. So mold is another one of these things that, you know, why am I sick? I don't understand why I'm sick. I've been sick for so long. We ever have water damage, and you're, oh, my office is water damaged, and it smells, and it's old, and run by the state, and they don't clean it properly, and got all these moldy symptoms. So it can cause, and if you look up Aspergillus niger and Stachybotrys atra and, you know, mucorrhizamosis and all these guys, Penicillium notatum, they can all cause anything from paranoia to cirrhosis. It can cause liver damage. So water damage has old office buildings, dizziness, brain fog, headaches, fatigue, depression. Yeah, had a 60-year-old cowboy. And he's, I don't know, he's probably 6 feet, 125 pounds, with chronic candidiasis. And I said, you know, I've been treating for candida for years. And then I started getting more into mold. And I said, you ever handle any wet hay? He said, no, only my entire adult life. So he's moldy, and he's much better. So all these guys are very common, and I'm sure you may have read about Richie Shoemaker's book, and he uses cholestyramine, and the cholestyramine, you can have it made, the commercial cholestyramine, I call it rot gut, because it's got, you know, polyethylene glycol in it, and sugar, and yellow 7 and yellow dye 7, yellow dye 10. But it's a lot easier to get down, but you can have it made by your compounding pharmacy. And you can get some with stevia in it, I am told, just last night. Make it a little more palatable. but it's gritty, but it does grab neurotoxins, and so these are fat-soluble neurotoxins. They never leave the body. You got to pull them out. And cholestyramine, as you may remember, is a drug usually used to reduce cholesterol. But these neurotoxins are coming out into the liver through the bile, and then they go into the bowel, then back up into the body, and back in the liver, and down the bile, and round. They don't leave, so you have to pull them out. And cholestyramine will remove these neurotoxins. And I was also reading Klinghardt of a few years back, and he feels that chlorella also absorbs these neurotoxins. And also you can use homeopathic dilutions of moles. And then Shoemaker Online has a visual contrast study test where you go online and there are these little bars of different colors that you can look at. And the score that you get on this test will tell you how much neurotoxin you have in your system. And that's kind of interesting for patients to get that feedback. And you all know about candida and thrush. I mean, there's a lot of great herbs and a lot of ways of going after it, and obviously diet. But I'm becoming more of a fan of fluconazole over the years. Now, coccidioidomycosis immitis, valley fever, I think it is very underdiagnosed in chronic pulmonary conditions, and people who have lived in the San Joaquin Valley, California or Arizona, should be suspects. So you see somebody that has a chronic lung condition, and you look at everything in their teeth and their metals, and nothing turns up, and you test them for cocci. And if you treat them, it can do much, much better. And sometimes the fluconazole, you really have to do it over a long period of time. And it has many other symptoms too besides lung symptoms. But 200 to 400 milligrams per day for 1 to 12 months can be life-saving. Parasites put tons of toxins into us, and every second or third person has this. Amoeba, Ascaris, Lumbricoides, cestodes, tapeworms, Trichinella spiralis, and flukes turn up on our EAV testing. And a lot of times people will have GI symptoms, irritable bowel, gas, distension, bloating, pain. So it's worthwhile to, and I think stool studies are pretty good, but a lot, if you send them to the hospital and they do it, on O and P, ovin parasites, nothing is ever found. So, and even in specialized big name labs, they'll send you back a result that says, parasites found, taxonomy unknown. Oh, thanks. That's just what I wanted to know. Nothing. All right, we like albendazole, tinidazole, Alinea, biltricide, stromectol are frequently necessary. And in my experience, herbs don't kill the worms. You got to go drugs to kill the worms, in my experience. Now, viruses, very, 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 very common. People come in and say, I'm falling asleep at my desk. I'm so fatigued, overwhelming. And especially people do a lot of children. I always like to say, beware of humans. Because you get all these, and especially us docs are sitting there getting coughed all over with the bad bugs. So looking for chronic fatigue is really worthwhile. And EBV, Epstein-Barr, Coxsackie, and you see a lot of Coxsackie pericarditis. If otherwise healthy people have a pericarditis with nothing else going on, frequently it's Coxsackie, which is named after a little town in New York, by the way. Cytomegalovirus, herpes 1, 2, zoster, HHV 6, and many others. So viral treatment is not always the easiest. We have the benefit of giving all these viruses diluted homeopathically, 3x, 12x, 30x, 200x, injected into spleen 6. That's an acupuncture point where 3 meridians cross, 4 finger breadths above the medial malleolus for 12 days. And patients usually get a real positive improvement in energy in 2 to 3 days. So I'm sitting there talking to patients at 3 o'clock in the afternoon, and I go, oh my God, I have 4 more patients. And I'm gee, I'm so tired. Viruses are back. So we treat ourselves with this 2-3 times a year. And other, immune stimulating stuff and IVCs and stuff are all really good as well. But this is part of your routine. The viral endotoxins are just killing people. They just rake people's adrenals. And there's another author, I forget his name, but he wrote the book Medical Medium. I don't know if you've seen it. Patients keep trying to stuff it down my throat, so I finally read some of it. And he says there are 65 different variants of Epstein-Barr virus. And if you don't have enough selenium on board, you'll just keep mutating one to the other. And you'll always have a little chronic viral infection, which I thought was interesting. So amongst other reasons, it makes me more interested in selenium. And toxoplasmosis. Toxo doesn't always come up for people. 23% of us have it. This is old cat poop fever. It survives in cat feces for 18 months in the environment. 50% of people, well, it's 23% actually, that's an error. People have it. Generally, it's silent infection unless it is not. It is more severe form, can cause headaches, unresponsive to pain medication. That's a tip-off. I can take all the drugs in the world. My headaches persist, doctor. What is it? And GI disturbances, nausea and vomiting, paralysis, lymph node separation, cognitive decline, and many other chronic symptoms. And I always ask the patient if they sleep with their cat. You'd be surprised how many people sleep with their cat. And so they're getting toxo, buried into them all the time. And so we had a real pretty Philippine lady in, and she had a big hole in her right neck, a big lymph node was broken down and suppurating. And of course, your first thought is, oh my God, it's non-Hodgkin's lymphoma. I know it is. I don't even need a biopsy. We'll just treat you. It's got to be lymphoma. So her husband says, well, I read up on it, and it could be toxo. So indeed, we diagnosed toxo, and you can get an IgM blood test or a stool test. Of course, we use EAV and get it in 30 seconds. But the treatment, you can do Daraprim. You remember the big Daraprim scandal last year? Where Sakali, what was his name, bought that drug company, and the Daraprim caps went from $8 a cap to $600 a cap, something like that, a tab. But azithromycin also works for it, so up to 1 year. And so, the husband of the lady said, it takes a year. Okay, and exactly 1 year of azithromycin, the big hole closed and the wound went away. So I was please. But again, weird neurological stuff, seizures, visual defects, numb areas on the head and in the body, I think it's toxo. And, it's there. It's just these things we don't look for all the time. So these poisons are environmental poisons. Now, we've been talking about chronic bacterial jaw ostitis, and I feel that these chronic maxillary mandibular infections are the rule rather than the exception. We all know the root canal teeth cannot be sterilized, and improperly removed wisdom teeth may become chronically infected, causing chronic disease. So EAV guys like me, we can diagnose it in a sec. And we also make bacterial jaw ostitis nosodes. So I don't know if you crank up your local homeopath. We make them from 30C, 200C, 1M, 10M, and higher, all the LM dilutions. And we can embed that into shots or tinctures. And I think it is very helpful when people are trying to clean up their mouth. And, they got 6 root canal teeth, and the dentist does one. And 3 minutes later, another one. And, so it's not frequently just not done all at once. And we do find, and again, being a kind of a more naturally oriented doc, I've been a little resistant to antibiotics over the years, but man, something you really have to use azithromycin or clindamycin to help slow down the toxic load against the body. And you know how sick people can get with their cavitations in their root canal teeth. And it's not pretty, neurological, visual disturbances, numbness is one half of their body, dizzy, not to mention scared to death by it's a brain tumor. I know it's a brain tumor. I've got cancer. I know it is. And it's your damn teeth. So bless you, dentists, to have the courage to help these people out. And and in Levy's book, his one dentist buddy functionally got run out of business for taking out 2 perfectly good root canal teeth that had radiological evidence and other evidence of infection. Well, getting down towards the end of things here. In October 2015, Townsend Letter. You guys buy Townsend Letter. It's really good. And not only my articles, but a lot of great stuff. And I learned something great in there every month when it comes out. And Colin's been putting it out for 30 years. Whoa. So Kirk Hamilton interviewed Alpha Fowler, MD, who's a professor of medicine, pulmonary disease, and critical care at Virginia Med School. And he did a 6-year study of sepsis, and he started with mice and rat models, and he induced sepsis, and he treated it with, oh my God, vitamin C. And so then he moved up into humans, and he found by only 13, 14 grams of C around the clock IV that he reduced the sepsis mortality from 62% to 38%. Now imagine what 50 or 100 grams IV around the clock would do. Did you see on Facebook, not Facebook, the other one, about the New Zealand dairy farmer who was in the hospital with swine flu, and both of his lungs were whited out. He was on a vent, and the docs called the kids around and say, Dad's just not going to make it. Say goodbye and get your things in order. And so he calls up Levy, and or the kids did. So what do we do? And he said, give him 100 grams of CIV around the clock. And they told the docs that, and they said, that's quackery. That's unscientific. We're not going to do that. So they went round and round and round. And then the kids finally said, hey, we're suing the hospital. If you don't do it, we're going to sue you. So they gave in. They gave him 25 grams of C. And within 3-4 days, he's off the vent. Then they did 100 grams C, and within 2 weeks, he's out of the hospital. He's back at his local hospital in the South Island. So they went to the hospital, and they did this again. All right, we want Dad to have 100 grams C. So we're not doing that. So they gave him 1 gram of C. No, not 1 gram, 100 grams of C. Well, within 6 weeks, he'd finished his rehab, and he's back to work, normal as pie. So you can, watch all this, what's the proper... YouTube, thank you, Baba. I know all these things. So at any event, we tried to get this into our local hospitals, and we had a patient, COPD, and horrible pulse ox, and on a lot of O2, and couldn't culture any bacteria, couldn't see any bacteria. Chest X-ray was normal, and we asked the daughter, said, "Why don't you suggest some vitamin C?" And the doc said, "We can't do that. It's going to interfere with our antibiotics. She just doesn't have an infection." So, yeah, I gave this to I sent this paper to the dean of the medical school at UNR, School of Medicine. I never heard back from them. So, in any event, there's lots of great stuff out there. There's a lot of ways of cleaning our bodies. We all have heavy metals and plastics, and we all have glyphosate, and we have probably still a DDT in us. So cleaning our body as many ways as possible, and this, not even talking about liver detox and kidney detox. In any event, I hope you can use some of this stuff and enjoy the rest of the shows.